On your arrival, every patient, regardless of appointment, will be asked to wear one of our face masks. These prevent droplet transmissions from our mouths and them going into the environment, so that protects all of us. If we're working up close with patients, you'll see that we'll also wear goggles. That protects the mucous membranes in our eyes receiving any of those droplets, another area for transmission. Also notice that we have these rather large plastic aprons. Again, this protects our clothing, and these are single use, so we only use these for one patient. These are changed after each. We obviously also wear gloves, and again, those are changed after every patient. Here you will see is the actual COVID swab that we used. Now, the majority of you will only have the COVID swab done. Some of you, depending on your surgery, may also have a blood test. But the COVID swab is a very slim, slender swab. We pop it into your mouth and swab both sides of the back of your throat. Some people find it does make them gag a little bit, but other people find it doesn't affect at all. It's fine, as you've seen, we've been very covered with PPE. The same swab then goes up each nostril, either side, just until we feel a little bit of resistance. We twirl it round, take some skin cells, and they go into the pot, ready to send off to the laboratory. I'll ask you to take your mask down. And then if I can ask you to open your mouth nice and wide, tilt your head back and give me a big ah. Excellent. So that's the mouth part of the swab. Then the same swab goes up each nostril, either side first. And we just push until we get just a little bit of resistance. And then up the other side, same again, until we get a little bit of resistance. And then that swab goes into the tube, we break it off, and it's all ready to go to the laboratory for testing. We get the results back usually by the following day, and we'll only call you if it's positive. So I'm just going to ask my colleague now, what did that feel like?
Actually really fine, it was fine. Not uncomfortable, not painful, it was fine.
Some patients do find it makes their eyes water, some find it makes them sneeze a little bit. We all have different sensitivities within our nose passages and our mouth. People feel quite nervous about coming in to have this done. That's partly why we're producing this little video, to show you what happens. If you are, just let us know. We're very gentle and we do this 20-30 times a day. We can take as much time as is needed, and just let us know and we'll talk you through the process.